best candidates are people that have more of a focal or a localized defect as opposed to diffuse degeneration of the joint. Those person has more of a diffuse degeneration, like majority of the joint is involved, they're really not a candidate. That person is a more acceptable candidate for joint replacement. But if it's more focal, the analogy would be like a pothole in a road, from whether that's a traumatic injury or just very localized degenerative change. Those are the patients that are a candidate. No, the overall condition of the knee would be the determining factor. If someone could be even in their 50s or 60s, but if their knee is in, the cartilage, the menisci, the little cartilage discs in there, if all those structures are intact, the knee's otherwise in good condition, I would not say that age is a limiting factor. It's more the condition of the joint. Well, the younger the patient is, generally, if you can do this, do a restorative procedure, that would be preferable. Because as soon as we put a prosthesis in there, more than likely in their lifetime that they're going to wear that prosthesis out, they're going to have to undergo a revision procedure. They may even have to do that twice if you're talking about someone, let's say, in their 20s or 30s. And doing a revision, let's say joint replacement, becomes more and more difficult and is fraught with many problems. So if we could do one of these procedures, let's say buy them 10, 15 years, maybe longer, I mean, there certainly is an advantage to that. Well, for some of these procedures, for these grafts to fully incorporate, for the new surface to fully mature, for them to really completely realize, the effects of this procedure, it can take anywhere from 9 months to a year. Initially afterwards, it's important to maintain motion, because any of these procedures, if we just were to mobilize the patient, lead to stiffness. So we do have them in physical therapy working on their motion, which also seems to be, from studies, seems to be important for cartilage nutrition. But a lot of these procedures also, we will limit their weight bearing, so they may be on using some sort of assisted device to take weight off of the extremity in question for a while. And by a while, that could be anywhere from 8 to 12 or 16 weeks, maybe longer, till we're convinced that this new graft material is healing. Once we get them weight bearing, they can start some light strengthening. But as far as getting back to, let's say, impact activities, if that's their goal, we don't even really think about that till, again, in the order of 9, 12 months.